Now, the International Federation of Red Cross and Red Crescent Societies has launched an emergency appeal of 3 billion Kenya shillings to support the Kenya Red Cross Society in response to floods caused by the ongoing El Nino rains. Kenya has been grappling with severe challenges brought on by heavy rainfall since this November 2nd, resulting in the overflow of rivers, deadly floods, and a pressing humanitarian crisis. Joined in studio by Peter Murgor, the Disaster Risk Reduction and Cash Manager at the Kenya Red Cross Society, to help us put this emergency into perspective. Thank you, Mr. Murgor, for joining us tonight.
Thank you, Ben.
Let's begin with the appeal for 18 million Swiss francs. Given that this is an emergency, what do we have timelines? How fast can this help get to the country?
Thank you, Ben. We are at a stage whereby we are realizing that the needs are getting compounded because of the nature of the disaster we are facing. Mm-hmm. If you look at the impacts of the floods, even as you've covered in your story, it's covering over half of the country. That means many more people are getting impacted, and hence when you see the budget of 3B is because people need food, people need medicine supplies, people need to be supported with mental health, well-being. There's water treatment because at this point in time, safe and healthy drinking water is scarce because it's contaminated already. So we are looking at basic humanitarian needs. People are displaced, no longer having their shelters because they're having to move to temporary settlements. We are talking about almost, at the moment we have 102 temporary settlements across those areas that have been affected.
Right.
So how fast this can get into the country is Red Cross has its mechanisms through the appeal to other well-wishers under the Red Cross movement, and has a temporary funding structure. That is in the process, and depending on how serious the situation is, and that has warranted international attention, mm-hmm. then probably in the next coming weeks we are likely to see some assistance coming in.
All right.
Yeah.
You, as Red Cross, are on the ground. Of course, we keep reporting what we get from our teams across the country, and of course the government makes regular updates. But from the Red Cross Society, what is the state of the country? What is the state of the flooding situation as we stand?
It's devastating. That's just the word I'll use. When you're talking about 76 lives lost as confirmed by the National Disaster Operations Center, when you talk about roads being cut off, and the northeastern side, for example, being cut off from the rest of the world, Wajir, Mandera, roads being impassable. Today, the guys in Mombasa woke up to the Mbogolo River being swept away. We are looking at contamination and all that. So it is really a devastating state. Even people are confirming that they've never witnessed such kind of flooding. So the situation is dire. We are talking about almost close to 40,000 households that have been displaced. Besides those affected, the numbers are even higher because we are just talking about those who have been displaced. But there are those who are affected because their businesses have been, they've been affected, they've been swept away. They cannot access, people who have chronic illnesses cannot access basic health care. Facilities have been disrupted. So the number is very big, and it's likely to rise in the coming weeks or months.
What would be the priority areas for Red Cross as we move along with providing emergency assistance to those affected?
Priority areas are, number one, temporary shelter, because people keep moving and they're trying to find a place to just have safe abode temporarily. So temporary shelter, and that comes along with food needs, because we have to support them with food. There is the need for their medicines. We look at medicine two-pronged. Mm-hmm. There are those who have chronic illnesses that need to continue accessing their medication. And then there are those who are likely to get unwell or sick because of what we're calling secondary impacts of the floods due to water and vector-borne disease outbreaks. So under the public health and emergencies, medication is an immediate need that we need also to take care of. Just to mention but a few. And then, of course, water. Water is a very important, essential, everybody knows you need water to survive. So we have to make sure that we have clean, safe drinking water and water treatment chemicals that are available to these people who are affected in the temporary shelters.
You've just mentioned the Mbogolo River bridge on the Mtopa Kilifi road. Many roads have been affected in that manner, making it harder to get that emergency relief food to those affected. What's the intervention for that?
Ben, in fact, Red Cross, we've found ourselves in a very precarious situation, because when we talk about the Northeastern, for example, being cut off, we've had now to be innovative and resort to airlifting food. And for the past 2 weeks, we've been airlifting food into Wajir, for example, Mandera, and most places that have been marooned and cut off. And now even it's getting more demanding, because as of early last week, people are now saying they cannot even have medicine. So then we are now having to think of doing emergency medicine supplies into these particular areas. So what is happening right now, and we were very happy to hear His Excellency today mentioning that he's just commissioned the KDF to fully give attention to this. And we commend the KDF because they've been part of those who've been supporting us to airlift this food. So those are some of the approaches that we are left with now, to try and airlift food where roads have been cut off.
When somebody, if you're speaking to maybe Kenyans who might be affected in various parts of the country, if you find yourself marooned by flood waters, what should somebody do as a first, you know, just before, even before help gets to them?
Yeah, the first thing is, don't try to get into running waters, because you don't know how deep, you don't know how fast. You could easily get swept away, and we have cases, some of the numbers being indicated to have passed away, drowning cases. So just try and get to a safe area, in that area where you're marooned. And we are monitoring. We are continuously doing assessments to identify missing people and marooned people. Right. And we've been able, even through using our aqua rescue teams and boats that we had prepositioned, to really get to these people and evacuate them safely. So don't try to get into the waters. Just try and get a safe area in the area that you're marooned, and help will come your way.
All right.
Yeah.
I want us to talk about, after this quick commercial break, partnership between, you know, Red Cross, which is on the ground very much with the government, and what that means moving forward. Let's take a quick commercial break here on NTV Weekend Edition. We are back shortly with more news for you. Stay with us. Welcome back to NTV Weekend Edition. We are speaking to the Kenya Red Cross Disaster Risk Reduction and Cash Manager, Mr. Peter Mulgore. Very quickly, before I let you go, Mr. Mulgore, how have partnerships between yourselves and the government, and what are plans to make this as effective and swift as possible?
Well, Ben, there's been lots of discussions and engagement with government. First of all, on the aspects of enhancing coordination, how we are going to have resources being coordinated. Red Cross works auxiliary to the government. That means, as a first responder, we complement the government in its efforts. So with the National Disaster Operations Center, we've held series of meetings, bringing together stakeholders and partners, including the UN agencies, non-governmental organizations, locally and internationally, to just come to one platform and have conversations on how we can collaborate, coordinate, and even have resources to be able to respond. So the partnership is improving and is bearing fruit, including right. Today morning when you saw His Excellency making a statement, and now even trying to channel all resources possible to be able to support the communities that are affected with floods. So there's enhanced partnership, there's enhanced collaboration, there's dialogue and discussions to make sure that together with the government and with other stakeholders, we are coordinating and collaborating to make sure the affected populations are supported adequately.
All right. And the rains are still pounding. We are still seeing El Nino and flooding, and before things get so much worse for some of these parts of the country, today we've had warnings from the Ministry of Energy about the 7 Forks dams possibly filling up, and people downstream should be worried. Are there things that can be done now to prevent some disaster over the coming next few days or weeks?
Yes, Ben. One of the things we want to urge the public and the communities that especially are living around at-risk areas, for example, close to the dams, close to waterways, and you know for sure that these places are prone to either being cut off or marooned. Please don't wait for it to be marooned or the situation to get worse. Red Cross will work with other stakeholders, the Kenya Met Department, NDOC, and government stakeholders, to just develop early warning messages. Please, when you receive them, when you see this message, people just need to take early action and move before it gets worse, because the idea is to mitigate as much as possible the effects from getting worse. We may not prevent the floods from coming, but we can try and prevent the losses associated with the floods, especially loss of lives and people being marooned.
Right.
So just get to safe area. Don't wait for it to get worse.
All right. Thank you, Mr. Morgan. That's where we leave it. Thanks for this information. I'm sure we shall speak with you again as we continue to inform our viewers as much as possible as the El Nino rains continue to pound. Peter Morgan, a disaster risk reduction and cash manager at the Kenya Red Cross.